So we're going to start with the bust model. So in no particular order, the first one I want to talk about here is at the top. Okay, this muscle here is called the frontal belly because this is the frontal area, right? And the frontal bone is here. So the frontal belly of the occipitofrontalis. The occipitofrontalis. Now we also have another part to this muscle which lies here, here and here. This is the occipital belly of the occipitofrontalis. Occipital belly of the occipitofrontalis. What the frontal belly is going to do in reality is when you flex that muscle, your eyebrows are going to raise and your forehead is going to wrinkle. Okay, so that's what the frontal belly of the occipitofrontalis will do. Raises the eyebrows, wrinkles the forehead, just like that. Perfect. Okay. All right, moving right along. We have some circular muscles. Circular muscles are also known as sphincters. When a circular muscle contracts, it closes. When it relaxes, it opens. So around the eyes, this muscle is called the Orbicularis for the round part. Okay, Orbicularis oculi. Orbicularis oculi. Similarly, we have another circular muscle that is around the mouth. This is the Orbicularis oris. The Orbicularis oris. Now, the Orbicularis oculi allows us to close your eyes or blink. The Orbicularis oris allows you to do duck faces in your selfies or kissy faces. One thing I want to point out before I go too much further is you'll notice in these models, they're asymmetric. One side of my model looks different than the other side. The reason for that is because one side is going to show, this side is showing deeper muscles. Okay, an easy way to see that is look at the ribs. I can see the ribs only on one side. So the deeper muscles are going to be on this side of my model. The more superficial or more surface muscles are going to be on this side. Okay, so that's one of the things to keep track of when you're studying. Okay, so the next muscles I want to go through are here, and give us a good view here. If you are still smiling, and I hope you are, if you're still smiling, there's two muscles that you're using to smile. The Zygomaticus minor and the Zygomaticus major. The Zygomaticus major muscle is going to allow you to smile by pulling the corners of the mouth upwards. Okay, that's the Zygomaticus major. The Zygomaticus minor, which is just above it, is going to help you to smile by pulling the corners of the mouth up a little bit, but more poofing out your cheeks. So the poofing out of your happy cheeks are done more by the Zygomaticus minor here. Okay. Oh, and the Zygomaticus major and minor is called that because it's over the zygoma. Remember, the zygomatic bone is the bone of the cheek. Now, sometimes you don't want to smile. Sometimes there's other things you want to do, like wince, okay? Here at number 13, this is the Risorius muscle, the Risorius muscle. When the Risorius muscle contracts, this pulls the corners of the mouth straight back as a wince, or like a ugh, okay? Lucille Ball from I Love Lucy is the master at this. If you look at the PowerPoint I have for this, I have GIFs of her doing the ew face. Okay, so the Risorius gives us our wince. Okay. Now at this time you might be wanting to pout, so let me show you what you would need to do that. You might be like, I don't need help pouting. but you do need to know the muscle that helps you pout. You might recall that the anatomical region of the chin is called the mental region. I think of the thinking man statue. The thinking man statue has him kind of squatting down, and his fist is at his chin while he's thinking. Okay, the thinking man. So the mental region, this is the mentalis muscle. Okay, the mentalis muscle. Well, what about chewing? All right. The more scientific term for chewing is mastication. So mastication is chewing, and we have two muscles of mastication, and the first one is right here. This muscle here is the temporalis muscle. And it's called the temporalis because it's over the temporal bone or the temporal region. Okay, you could see either one. So this is the temporalis. And you might say, well, wait a minute, Professor. I don't chew with my head. Well, I beg to differ. If you do this with me, I won't feel so silly. But if you put your hands on either side of your head over your ears and just move your jaw up and down. Now, if you ever see somebody that's bald, or like a little baby that hasn't had hair yet and you see them sucking, you can actually see that muscle moving in and out. Looks kind of cool. Okay. So that is your temporalis muscle. The second and final muscle of mastication is a little bit more intuitive, and it's only seen on the superficial side, so I'm going to change this over here. So right here is the masseter muscles. The masseter muscle. And this is a little bit more obvious because it lies right over the jaw, and it functions to close the jaw. All right, so the masseter. Underneath the masseter, if I were to take off the masseter, I would be able to see the muscle of the cheek. The muscle of the cheek, you might recall that the cheek is the buccal region. I think of a bugle, somebody tooting the bugle or a horn, and the cheeks puffing out. Okay, the bugle region or buccal region. And this is the buccinator. The buccinator. So the buccinator sits in the cheek, and it's a little deeper. It sits underneath some of the other muscles here. Okay, so this is the buccinator muscle. The buccinator does not help you chew, but it helps to hold the food between the teeth so you can chew. All right, next let's move to the area of the neck. So this is the deep side here. This is the more superficial side here. The muscle of the neck that I want you to know is the sternocleidomastoid, and that is this muscle right here. Let me give us a little bit of a better view. Okay. The sternocleidomastoid muscle has its relatively long name because it's named for where the muscle attaches to the bones. So it attaches to the sternum, so that's where I get the sterno part. It attaches to the clavicle, that's where I get the cleido part, so sternocleido. And the last part is actually up here, and it attaches to the mastoid process of the temporal bone. So for that reason, this muscle is called the sternocleidomastoid muscle. Now, if you see this in real life, they probably will not take the time to say sternocleidomastoid. They'll say the SCM muscle. Okay, so when you hear SCM muscle, it's the sternocleidomastoid, but for me, please do spell it out. Okay, so this is the torso model. So we're going to start at the top and work our way down. You'll notice there's quite a few muscles on the torso model that I could also ask you on the arm model, for example, or the bust model. So we're going to somewhat start at the top and work our way down again. So starting here, this is the frontal belly of the occipitofrontalis. Okay, this functions to raise the eyebrows and wrinkle the forehead. frontal belly of the occipitofrontalis muscle. Similarly, and this would be the occipital belly of the occipitofrontalis muscle. The occipital belly of the occipitofrontalis muscle. So here we see the Orbicularis oculi, muscle. This allows us to blink, to close our eyes. And around the mouth, we have the Orbicularis oris muscle. This allows us to do the duck face, to do kissy faces. Orbicularis oris. You have two muscles that allow you to smile. Hopefully you're still using them. Okay. We have the Zygomaticus minor muscle and the Zygomaticus major muscle. So they look a little bit different in this model. Zygomaticus major pulls the corners of the mouth up for our smile, and the happy poofy cheeks come more from the Zygomaticus minor, which is on top. Zygomaticus minor, Zygomaticus major, and it's named because it's in the cheek, it's over the zygomatic bone. Okay. Now at this time you might be wanting to wince instead of smile. So, and if that is you, then you would want to use this muscle right here, which is the Risorius. The Risorius. This pulls the corner of the mouth straight back or straight to the side, laterally, for our wince. Okay? And if you're going to wince, you might as well pout as well. So if you're going to pout, you want to use your Mentalis muscle, which is here in the mental region of the chin, the Mentalis muscle. Our muscles of mastication include the Temporalis muscle, which is shown here, the Temporalis muscle. This sits over the temporal bone in the temporal region. Our other muscle of mastication, we can see on the other side. Underneath this is actually a salivary gland. So underneath the salivary gland here, this is the masseter. The masseter. Underneath the masseter, we have the muscle of the cheek or the buccal area, and this is the Buccinator. The Buccinator. We see in the region of the neck, here we see the sternocleidomastoid muscle, the sternocleidomastoid muscle, and that gets its name for sterno, for the sternum, cleido for the clavicle, and mastoid for the mastoid process of the temporal bone. So sternocleidomastoid muscle. And that might be a good way to help you for your practical exam. Here is the pectoralis major muscle. The pectoralis major muscle. Okay. If I were to remove the pectoralis major muscle, I would reveal this muscle here, which is the pectoralis minor muscle. The pectoralis minor muscle. Moving this to the side slightly, we reveal another muscle that has a serrated edge-like appearance. So if you imagine a serrated knife edge, this muscle is called the serratus anterior. Serratus anterior. Serratus anterior. All right, let's look at some of the muscles of the back now. So on this side we have our deeper muscles. Our more superficial muscles are on this side, so let's do that side first. This large muscle here that includes all of this all of this. This entire muscle is the trapezius. The trapezius. Now, if you could imagine that I have this big muscle on both sides, then it would be the shape of a diamond or a trapezoid. That's where the trapezius gets its name, from its trapezoidal or diamond shape, the trapezoid. We have this large superficial muscle of the back, which is the latissimus dorsi. If you're at the gym, you might hear somebody say, oh, I need to work my lats. Okay, what are they talking about? Talking about the latissimus dorsi. Latissimus dorsi. This helps us do things like pull-ups or a hammering type of motion or swimming. Okay, those types of motions. Latissimus dorsi. This main muscle of the shoulder here is the deltoid. Now the deltoid includes all of this. Now the deltoid, you can hopefully see that it's kind of triangular shaped. The deltoid gets its name because it looks like a triangle, or the Greek letter delta. Okay. The deltoid. Deltoid. All right, next let's look at a group of muscles called the rotator cuff muscles. The rotator cuff muscles support the shoulder joint. It's also a hot spot for injuries. You might recall that the shoulder is not very stable. It doesn't have a lot of bone to it. You know, it gives us a lot of flexibility, but not a whole lot of vigor or strength. Okay. So let's look at those muscles next. So these muscles are deeper. Let's first identify what it is we're looking at here. This entire structure is the scapula. This is a portion of the scapula coming through. And this portion specifically is the spine of the scapula, or the scapular spine. Okay. This muscle that lies superior to the scapular spine is the supraspinatus, or supraspinatus, if you will. Okay, supraspinatus, or spinatus, to jog your memory that it's over the spine. Okay, supraspinatus. Similarly, we have this large muscle underneath, or inferior to, the spine of the scapula, and as you might have guessed, this is the infraspinatus. The infraspinatus, or spinatus, if that helps you remember. There's one more rotator cuff muscle that is visible in this model, and that muscle is this smaller triangle here. Okay. This is the teres minor. The teres minor muscle. Teres minor. There's one more rotator cuff muscle that is seen in the arm model that we can't see in this model, and that's the subscapularis. So it's just not visible in this one. But we will go over that when we go over the arm. This muscle here, so this was the teres minor. This muscle here is the teres major. The teres major. It's not one of the rotator cuff muscles because it wraps around and goes towards the anterior portion of the arm, but this is the teres major. So teres minor, teres major. This here is showing a portion of the triceps brachii muscle of the arm. The next thing I want to show you is the internal and external intercostal muscles. Now, when I say costal, like the costal cartilages, for example, costal means of the ribs. It's kind of hard to tell, but let me show you the borderline here of this. So right here, there's a little line. Here, there's a little line. Okay. On this side, it's slightly darker where I'm pointing. So it's slightly darker here. The internal intercostal muscles are rotated forward. They're rotated forward, and they come into almost into contact with the sternum. I see some, so if there's a little line here too. I see some of the internal intercostal muscles here as well. So internal intercostal muscles is this darker that's rotated forward closer to the sternum. So that means this lighter colored portion here, here, and then all of this here, this is all external intercostal muscles. External intercostal muscles. There's even some here in the back as well. Okay. All of that would be external intercostal muscles. All right. The first abdominal muscle I want to talk about is this one that is straight in the front. Also, I want you to notice that the striations or stripes, the orientation of these muscle fibers is straight up and down in this one. This is the rectus abdominis. Now the word rectus means straight. For example, you might have heard of the word rectum. The rectum is the portion of the colon that straightens out, so that's why it's called the rectum. Okay, so rectus, you'll hear that word a couple times in anatomy and in the muscles as well. So rectus, meaning straight. Okay. So this is the rectus abdominis. Now, if you're very, very fit, you might actually form a six-pack. So if you see is that six-pack, that's formed by the rectus abdominis muscle. Okay. The next abdominal muscle I want to talk about is the internal oblique. Now you might recall that oblique goes at an angle. Oblique means diagonal. Okay, so this, because I have the ribs on this side, this is deeper, so this is going to be the internal obliques. The internal obliques. This allows you to rotate your torso side to side. Also, if you're doing sit-ups and doing elbow to opposite knee, okay, switching sides like that, that's when the obliques come into play. So this would be the internal obliques. And on the other side, which shows the more superficial muscles, you might notice that the obliques on the other side were oriented this way. These are oriented this way. So they're diagonal, but they're completely opposite. And they work together. So these are the external obliques. The external obliques. And last but not least, gluteus maximus. Okay, the gluteus maximus. I keep working out trying to get my gluteus maximus to be my gluteus minimus. Okay, gluteus maximus. What you're viewing here is the back of the arm. The first thing you might notice here is the deltoid. Okay, this is the deltoid muscle here. These muscles here and here, both of these muscles, along with this one over here, these are the triceps brachii muscles on the back of the arm. Triceps brachii muscles. So number 44, if you follow that down, you'll see that the tendon leads to the middle fingers. Okay, this is the extensor digitorum. So this is your flipping off muscle. The extensor digitorum. Okay, use the power wisely. This one here, it's on the posterior portion of the forearm. It's an extensor. What is it going to extend? It's going to extend the carpi, or the wrist, and it's on the same side as the ulna. So for that reason, we call this muscle the extensor carpi ulnaris. The extensor carpi ulnaris. So this would be looking from above. And here I can see some of the biceps brachii muscles. So biceps brachii is right here. The triceps brachii is here. And in between the two, on the superior side here, this is the brachialis. The brachialis. All right. Also, if you look at this tip of the deltoid, it goes straight to the brachialis. That might be a good way to remember this. The brachialis. Now, if I follow the brachialis down, and I get to this muscle here that kind of wraps around. This portion here is the inner elbow, right? This is the biceps, brachialis, and then this muscle is the brachioradialis. It's called the radialis because it's on the thumb side. All right, remember that the radius is on the thumb side. So it's called the brachioradialis. Brachioradialis. All right, so just real quickly, deltoid. This is the brachialis, biceps brachii, triceps brachii. All right. So brachialis, and then this muscle here is the brachioradialis. Okay, the brachioradialis. You'll notice there's another little muscle here that just goes from here to here. This muscle is the pronator teres. The pronator teres. The pronator teres. This next muscle, this is a muscle of the forearm. It's on the anterior portion, so it is a flexor. What is it going to flex? It's going to flex the wrist or the carpi. What side is it on? It's on the radial side, the side of the radius. So this is the flexor carpi radialis. Flexor carpi radialis. Okay, flexor carpi radialis right here. Here's the pronator teres. This is the flexor carpi radialis. And the next one over, if I follow this, I'll see that the tendon goes straight to the palm. So this is the palmaris longus. Palmaris longus. And just think of it because it goes straight to the palm. Palmaris longus. So this is the flexor carpi ulnaris. Ulnaris because it's on the pinky side, or the side of the ulna. Okay, so flexor carpi ulnaris. All right, so that is the flexor carpi ulnaris. This is the extensor carpi ulnaris. This is the extensor digitorum. Extensor digitorum. This is the extensor carpi radialis longus. Extensor carpi radialis longus. Okay, it's an extensor carpi radialis and it's long versus number 43. This one is shorter. So this is going to be the extensor carpi radialis brevis, meaning short or brief. Okay. Extensor carpi radialis brevis on that one. Okay, the subscapularis because it's underneath the scapula. So subscapularis. The biceps brachii in this inner view. Both of these are triceps brachii muscles down here. Okay, the first thing I want to show you is this is the spine of the scapula here. The spine of the scapula. This is the acromion process. And this over here is the clavicle. Okay, so that's making that top portion. So that means that this muscle here is going to be the supraspinatus. So this is the supraspinatus, and this one is the infraspinatus. The infraspinatus. Now I have a small little portion, a little triangle poking out here. This is the teres minor. All right, so we have the teres minor, infraspinatus, supraspinatus, and then the fourth rotator cuff muscle is the subscapularis, which we see here. And then the last muscle that you need to know on this model is the teres major. Let me try to get us a good view. Teres major. Okay, so this is the anterior portion of the leg. Let's start with the quadriceps muscles. This is the rectus Remember, because rectus means straight, so straight in front. This is the rectus. This is the femoral region. So this is the rectus femoris. The rectus femoris, one of your quadriceps muscles. The muscle just medial, this is the medial side over here. This is the vastus medialis, the vastus medialis muscle. Okay, meaning big medial muscle. Okay, vastus medialis. The other quadricep muscle that we have is lateral, and so let me tilt this lateral. This is the lateral view now. This is the vastus lateralis. Vastus lateralis. Now the vastus lateralis is indeed vast, and it's going to continue, and it's going to go underneath this tendon here, and it's even going to continue just right here. Okay, so all of this is vastus lateralis. Vastus lateralis. Now the muscle that the vastus lateralis goes under here, I see this big long tendon. Now this tendon belongs to this muscle here, which is the tensor fasciae latae. Tensor fasciae latae. All right, and this big long tendon belongs to this. Tensor fasciae latae. So here we have a great view of the gluteus maximus. This entire muscle here is the gluteus maximus. All right. This, what we're seeing here, is still part of that vastus lateralis. And these muscles here at the back of the leg are known as the hamstrings group. The hamstrings group. But that's not enough to put hamstrings group. I want you to name them individually. So the one that's more lateral, so this is medial on this side, lateral is on this side, and we're looking at the posterior view. This muscle here is the biceps femoris, because this is the femoral region, right? So biceps femoris. Biceps means it has two heads. Biceps femoris. The hamstring muscle that lies more medially is here, and this is the semitendinosus. The semitendinosus muscle. Underneath the semitendinosus muscle, we have the third hamstring muscle, and I can only view it right here and right here. It lies underneath the semitendinosus muscle, and this is the semimembranosus muscle. So remember that the semimembranosus sits underneath, tends to sit underneath semitendinosus. So here we get a little bit of a better view. This is that semitendinosus. This is part of that semimembranosus that lies underneath it. And here on the side, I see a muscle right here. This is the adductor magnus. Adductor magnus. And this muscle is the gracilis. The gracilis muscle. I think of a gracious ballerina doing a plie. The gracilis. Okay, continuing to move along. Here we see a little bit more of that adductor magnus. Okay, so the adductor magnus is there, and then also just back here. Okay. This muscle here is the adductor longus. So we've got adductor magnus and adductor longus, and it might not look very long, but it does continue deep to these other muscles here. Okay. And the last muscle you need to know for the femoral region is this large strap-like muscle here. This muscle is called the sartorius. The sartorius muscle. This is the muscle that allows you to play hacky sack. It allows you to bring your inner foot up. Okay, also if you're crossing your legs, sitting on the floor crossing your legs, this would be the muscle that is allowing for that cross-leggedness to happen. Okay, so the sartorius muscle. And then we see we're back where we started. And you might notice that we have part of the tibia that's showing up right here. This is our shin. Okay, this is the tibia, which makes this muscle right here the tibialis anterior, because it runs over the tibia. Tibialis anterior. All right. The next muscle you'll need to know, so that was the tibialis anterior because it's over the tibia. But we also have the fibula. Okay, so we've got the tibia and fibula, right? So the fibula lies on the outer portion of the leg, and this muscle lies over it. So this is the fibularis longus. The fibularis longus. It's number 32 in this model, fibularis longus. This also has another name called the peroneus. Either one's okay, but I prefer the fibularis longus because it tells me where it's at. Fibularis longus. Okay. All right, here. The calf muscles are called the gastrocnemius muscles. Now, it has such an odd name because whoever named these decided that the gastrocnemius muscles looked like a stomach. Okay, so the stomach, that's a gastric region. Okay, so stomach, so gastrocnemius muscles, because apparently they look like a couple of stomachs here. Gastrocnemius muscles. The last muscle you need to know is the soleus. The soleus lies underneath the calf muscles or gastrocnemius muscles. Where you can see it is here. Okay, so this is the soleus, and also on the other side as well, underneath the calf muscles, soleus, the soleus. Okay, questions, comments, panic attacks? Did I leave anything out? I don't think so. Okay, you may now run away screaming, and you may now wake up. Oh, that's okay. I'd probably sleep too if I could. Especially with the dim lighting and stuff, so. Alrighty.